Hi, and welcome to my webpage. There's a few reasons why you're sitting in front of me today, and because you are trying to research and understand your thyroid better. And there's two kinds of people that I know that are really researching into really finding out what's going on with you. You might be the person that has been diagnosed with thyroid problems, and you might be taking medications from your doctor like levothyroxine, Synthroid, but yet you still have all the symptoms. You're still losing your hair, you're still overweight, you still have fogginess, your fingernails are very weak, right? But above all, you're sluggish and tired, right? And deep inside of you, you know there's something wrong, and you are out there searching the web to find something organic, something different, and what else can you do differently to feel better, right? Or you might be that patient that says, hey, I have all the symptoms of the thyroid, and every time I go to my doctor, it says that I have a balanced thyroid, and your problem and your overweight and your tiredness and sluggishness is really not coming from the thyroid. Yet you go out and research every person that writes a book about hypo or hyperthyroid. You take all the supplements like iodine, selenium, zinc, thiamine, and yet you're still having the problem. You're still overweight. You're still having these issues, right? And you're looking for a solution. And you just can't seem to find the right solution because everybody's giving you different information, lack of information, wrong information. And the world of the web today is really incredibly unbalanced. But at the end of the day, though, I'm glad that you're here because I am going to bring you a different approach of understanding your thyroid. Okay. And yes, all these imbalances you're dealing with is very common. You're part of that 90% of people who has a misdiagnosed thyroid. And I'm going to bring light to why you're misdiagnosed. Okay. How can we help you? I'm going to bring solutions to you. You see, I'm even going to bring you a home kit called the IW method that's going to educate you and explain to you and really do home walk step by step and teach you how to restore and balance your thyroid on your own. I do have a substance to provide for you that is organic, that increases that thyroid function, but this substance is not a pill fit all. You see, you're all made different. And if I give you the same thing for everybody, then it's not going to work for you. And maybe that's the reason things, the supplements and substances you're taking are maybe not working for you for that reason. But I am going to tell you this, that I'm going to teach you how to look at labs. And I'm going to provide that for you in my kit of how to identify the labs, what to take, and how to monitor it on your own. Wouldn't that just be awesome to really know yourself, how your thyroid works, and have a substance that you are controlling of what your specifically body needs? So that's what I'm bringing to the table to you to you, and I am bringing solutions. And I hope this will be the last time you go into a website and get all the information, because everything that I'll teach you and educate you here will make sense. All right. So again, guys, I'm Dr. J here in Imagine Wellness. I'm going to turn my slides on, and I'm going to really share my screen, and let's get started in education. But also at the end of this presentation, I am going to provide for you the solution and what is it that we can do for you. Okay, so let's get our slides going, and let's get started. Okay, so all right, again, Imagine Wellness is the Imagine Wellness Center is the my office, and it's located here in San Antonio, Texas, but I do deal with patients all over the nation. So in fact, I have patients outside of the nation. So again, don't worry, this is made for all of us here, and we can really get to you and bring things to you to your door at any time. So let's begin. All right. So again, I spoke about symptoms earlier, but there are some certain symptoms that you're going to have accordingly to what you're dealing with, as far as the overweight, the constant fatigue, the menstrual cycle imbalance, the dry skin, right? What's going on with my eyebrows? What's going on with my poor thinking? Even pain and inflammation. But some of you who are in that hyperthyroid dysfunction, you are going to be losing weight, irregular palpitations in your heart, high blood pressure. You're going to be, hungry all the time. You're going to be very nervous, shaky, can't sleep. Again, those are typical symptoms that if you're dealing with those, your concern is because you have hyperthyroid. And some of you guys maybe have already been diagnosed with hyperthyroid, and we're going to talk about how that works. So let's get started, right? Let's talk about your thyroid and how is your thyroid regulated, and where is it that most doctors are missing it? And what am I going to bring to the table to you that is different? Now, this is how it works. Okay, your body, okay, your thyroid is controlled by the pituitary gland, which is a little gland inside of your brain. Right? This is what the pituitary gland governs your thyroid, and your pituitary governs your thyroid through a hormone called TSH, thyroid stimulating hormone. Every doctor in the world is going to look at that TSH as the gauge of you having hypo or hyperthyroid. But in reality, the TSH or your pituitary controls and tells the thyroid to produce that hormone called T4, okay, either to produce it or decrease production. And that's kind of how your body governs the thyroid hormone. So remember, every cell of your body needs a thyroid hormone. The thyroid hormone, every cell needs what? The fuel to activate and create function of all cells, and all cells make organs. So it affects all organs in your system. So this is how important this hormone is. Right? But understanding it and where we need to go here, let's talk about that. So now let's get into subject here. So remember, your pituitary governs your thyroid through the hormone called TSH. TSH works opposite to the production of T4 hormone that comes from your thyroid called thyroxine. So let's say that your TSH is very high. So the government, the pituitary, right? The government tells your thyroid to produce, to produce more. Why? Because they work opposite to each other, right? Your TSH is high, T4 should be low. This is what you're going to call hypothyroid. In a normal thyroid, in a normal system, is when your pituitary with a TSH is elevated, your pituitary, your government tells your thyroid, hey, produce a little more. So it produces more, your TSH drops, your T4 goes up, and then it's balanced, and then you're good to go. That's how a normal thyroid works. But let's say that you're not having that. You have a diagnosis called hypothyroid. Same thing. TSH is very high, T4 is very low. Your pituitary or the government calls the thyroid to produce that T4. It doesn't listen to it, so it can't produce it. And if it can't produce it, we need that T4. So your doctor is going to give you medications like levothyroxine, Synthroid, and other medications to increase that T4. By giving you that synthetic T4, your TSH drops, T4 goes up, and then it becomes normal, and then your doctor says, hey, we're good to go. Now, as I'm sitting here, I'm going to explain to you the inactive form of T4 and the T3, because your thyroid produces about 93% of the T4, okay, and about 7% of the T3. Let me explain what makes sense. Here is where most doctors are missing it, and this is what I'm going to bring in bring a little bit of solutions for you. Is this? You see, your thyroid T4 hormone is inactive. So your thyroid is producing a completely inactive hormone. So T4 doesn't do anything to your body. You know that energy that your cells need in every cell, right? The hormone that comes from the thyroid that your body needs for the function of energy in all cells is T3 hormone. But your thyroid is only producing about 7%, not even close to be enough. So that T4 is inactive and needs to be activated to T3. T3 is what we're looking for, all right? I will move forward and I will explain that to you little by little, but I just want you to remember that right there, your doctor, when he's diagnosing you on this thyroid imbalances, he's only looking at the TSH and he's looking at the T4 to tell you if you're hypo or not. Me, we're going to take it a step further, which is the most important step that everybody's missing. So this is hypothyroid. But if you have hyperthyroid, it plays the same role. Okay, it's opposite, right? Your TSH is going to be very low. Okay, the pituitary, your government calls the thyroid, hey, produce more, produce less because we have too much. Your thyroid doesn't listen and it can't produce less. So what happens? You got to take a medication to decrease it. Like there's a few metronidazole and some other medications that will decrease the production of your T4, right? Or if that treatment doesn't work, the next step is to do what? Get rid of the thyroid. Okay, just surgery, right? Just surgery and take it out, right? So again, if you don't have a thyroid, then you don't produce T4, then you become hypothyroid. But what happens? Earlier, we talked about the solution for hypothyroid is to give you what? A synthetic T4. Now you take a synthetic T4 because you don't have a thyroid anymore, and that's what you need, what you're going to need for the rest of your life, T4 hormone. All right. So again, this is what we call hyperthyroid. Pituitary, right? Government is TSH is too low. your thyroid, okay, is really producing too much, right? High T4, hyper, right? And now we're going to get rid of the thyroid or give you medication to calm that down. And that's the solution to all of these problems in hyper, and hypo. Now, let me take it a step further for you here, okay? Let's say that you are diagnosed with hypothyroid, and that's the reason why you came to my page, right? You're looking for solutions and what is going on with me. My doctor diagnosed me with hypothyroid. I'm taking my levothyroxine. My doctor says that my TSH, right, pituitary, is normal. And he's also saying that now my T4 is normal. But why am I having all these symptoms, right? Why am I having these symptoms? So what happens here is this, right? We spoke about that. Right? We spoke about, A, if your thyroid is normal T4, either by the thyroid producing it or taking synthetic medications, you need the active hormone of T3. And if your body does not break down that synthetic medication and it does not like it, then you're not producing my T3. And if you're not producing my T3, then you don't have the energy to all cells. See, this is where most doctors are missing it. They're not taking the extra step to look at what? At your T3, that's my active hormone that's giving me that. But we do need T4 because from T4 is where we get our T3. That T4, we need to activate it to T3. Now, my thyroid is only producing about 7% of my T3, not even close enough. So what's next? Let's talk about the conversion. What is my body doing to convert this inactive hormone to the active hormone? Okay, so let's talk about that. Your T4 hormone, okay, what your thyroid is producing or your medications that you're taking are inactive. They will go to the liver, okay, and your liver will convert T4 into T3, okay, 60% of that, 93%. The other 20% is in your digestive system. Now imagine that you're having a lot of issues in your liver. You high cholesterol, fatty liver, you're having kind of cirrhosis, some kind of liver infection, in dysfunction. Could that be a reason why your liver is not working right and is not converting my T4 to T3? And that could be giving me what? My symptoms of hypothyroid? Yes, because you're not having the active hormone of T3. Same thing in your gut. If you're dealing with problems in your digestive system where you have hiatal hernias, GERD, acid reflux, diverticulosis, Crohn's, IBS, whatever it might be, could that be a reason why my body maybe is not converting T4 to T3 because all that dysfunction there? Yes. Can I have those symptoms even though you're taking the medications and your TSH and T4 is normal? You can still have hypothyroid symptoms? Yes. This right here is what your doctor is not taking it to the next level. Not only that, okay, you got to look at a thing called free T3. This is the most important gauge to me. And again, let me explain this a little bit differently, okay? Let me tell you a little bit of a different view so you can understand me a little bit better, because a lot of times it's T4, T3, and Dr. J, hey, you talk too fast and I cannot get what I can understand that. So I'm going to clarify it for you, okay? Imagine this. All right, let's talk about that. Let me go to the next slide here. Let's talk about this, okay? Let's say that my thyroid, my T4 hormone production from the thyroid is gasoline, okay? Now, that's what my thyroid is producing, right? But your engine doesn't run on gasoline. It runs on diesel. It is impossible for my gasoline to make my diesel engine run. Same thing with your T4. Your thyroid is producing 93% of this gasoline. It is impossible to that T4 to go out and create energy for you because it's not activated. We need to activate it to that T3, okay? So that T4, we need it because we're going to get what? We need gasoline because that's where we're going to get our gasoline to create our diesel. So therefore, my T4, okay, goes to the refinery. My gasoline goes to the refinery, which is in my liver. And that's where it converts 60% of that 93% into my diesel. And it goes into my digestive system and it creates another 20% of that diesel. And that together gives me my energy that every cell of my body needs. Now I have the energy because I have the right fuel. And your doctor is not looking at the right gauge of fuel. He's looking at the gasoline fuel that does not provide the energy. He's just providing the raw source of an inactive hormone. This is what I'm bringing to your table in my process and explaining to you this IW method that you can do in your own home. I'm explaining to you why is it that we're not looking all the gauges at what your doctor's looking at, because they're looking at the wrong gauges. I want you to look at the right gauge. And I want you to understand how your body processes and creates energy and gets you back on track to your health. And this is huge, right? So let's talk about your absorption. Let's say that your body converts T4 to T3, but what do I need to absorb? Well, this is what happens here. Your free T3, imagine that is the purity of your fuel. I know I'm talking about diesel, but let's say that the T3 active hormone is more like my regular fuel, and like, regular unleaded, and my free T3 is super unleaded. It is purified, and it is the most effective absorption into your cells that's going to give me my energy. So when I'm looking at you, my gauge that is the most effective gauge to look at is your free T3. Why? Because that's what your body has to absorb. And that is the most effective. And I will teach you how to really understand the free T3. And remember, it's monitored. I cannot give a pill same for everybody. It's got to be monitored of what you need according to the gauges of this free T3. And when we're talking about ranges, we're talking about your body having variety and broad ranges on the TSH and T4. I'm going to give you a more specific optimal level where your body is going to work optimally, and you're going to get it there yourself by understanding labs and by understanding the substance that I have for you. It's completely organic and it's very easy to follow. Now, okay, so again, now let's say this. Okay, now we talked about absorption, right? Let's talk about, why is my thyroid not producing? Where is my production coming from? So some of you guys are dealing with autoimmune disease, right? Hashimoto's or Graves'. And a lot of you guys have never been really tested for this. Why? Because there's no cure for autoimmune disease. And there's over 80 different kinds of autoimmune diseases out there. Like fibromyalgia, rheumatoid arthritis, Hashimoto's Graves' disease, Sjogren's, you're looking at eczema, psoriasis, multiple sclerosis, so on and so forth. There's over 80 different diseases out there. And there's no cure for them. There's some treatments, but there's no cure for them. This is the reason why. Why would somebody want to test your thyroid if there's no cure to it? But the autoimmune, okay, how is my body? Actually, my autoimmune disease means this. It means that your own defense mechanism has gone crazy and starts attacking your good tissue and your organs. Okay, but how did my body get to the point of attacking itself? That's because you're so full of inflammation. And inflammation is the biggest reason how your body becomes confused to attack yourself. And we'll talk about inflammation. But right now, in this online testing, I'm going to provide this information. We are going to test these antibodies. Okay, this antibody means that we're going to check if your body is attacking your thyroid, and we're going to look at the thyroid peroxidase antibody and the thyroglobulin antibodies that dictates to us if your thyroid has had an autoimmune attack. In other words, is your own defense attacking it? If your defense is attacking your thyroid from that attack, if it decreases the production of your T4, okay, that's what you call Hashimoto's. Okay, you have hypothyroid from an autoimmune attack, and the name is Hashimoto's. It goes opposite to that. The same attack to your thyroid increases that T4 hormone. That is called Graves' disease. You have hyperthyroid from an autoimmune attack, Graves' disease. Okay, 90% of the people that don't produce enough hormone comes from this attack. So we really need to look into this for sure. And that's what I'm looking at when I'm looking at your autoimmune disease. See, when your defense mechanism is starting to attack your thyroid, that's when you create so much inflammation, you create nodules, you might create cancer. It just brings food to create all these different dysfunctions. So this is the reason why it's important to understand that autoimmune is huge, and inflammation. What is causing inflammation in your body? So you see, I'm not just looking at your thyroid to balance the hormone, the T3 and the free T3, right? I'm also looking at your thyroid that it's not creating inflammation and autoimmune. But what creates the inflammation in my body that creates this imbalance? And what I look at that we have great results, okay? I'm not giving you a substance or a supplement. I'm looking at the infrastructure of your body and how it works. So therefore, okay, what comes into your body that could create a lot of inflammation? And in my office, what we look is leaky gut and leaky gut syndrome. The permeability of your gut. when you eat foods, regardless of this nutrient value, regardless of its, if you're eating the kale, the beets, and you're eating the cucumbers, and that's my green, ginger in the morning, and you think that you're doing great for your body, but if your body is attacking those foods because they came in through this permeability, it's creating inflammation. And every time you eat it, you create inflammation, and that's the overgrowth of inflammation that's making my defense mechanism attack itself. I can explain that to you in a specific webinar, but for right now, I'm just telling you, this is where we're going to go into the autoimmune world of all these other diseases. And now it's not just about your free T3, understanding it. Now we got to decrease the attack to your thyroid in something that there's no pills for, in other words, there's no cure for, but your body can't control it if we really get rid of that inflammation. Okay, so again, this is what I'm looking at now. I know that I spoke to you guys about thyroid, and I was telling you that I do have a solution for you as a kid, and I do have all that for you. But that doesn't mean I'm not going to work with you with other diseases, okay? Because in reality, to really find the root cause of your imbalance, okay, is by looking at health systems. And the way I help my patients through the health system is that we do have a, let me see here, we do have a process of understanding, okay, the digestive, the endocrine, neuroendocrine, and circulatory system. This is what I really help my patients with. We understand that these are all integrated with each other, okay? And just truth be told, we just spoke about that, right? Your pituitary and your thyroid, which is what, an endocrine system, is connected to your gut, right? Conversion of T4 to T3, your digestive, circulatory system, your liver. You see how these three systems work for you to work better? But you never hear this. You see, they teach us in school to look at the thyroid and balance the thyroid. I'm taking that step further to say, you know what? The infrastructure of your body is balanced by understanding the gut and the liver, because that's what's going to help you control your thyroid. See, if that's your issue, we got to concentrate on those. One thing is having the normal, right? The normal function of your free T3 that I spoke about so much, but this is how I look at your health, right? And there's a variety of different things. If you're having problems, like I said, with digestive, if you're having problems with the liver, high blood pressure, inflammatory responses, all right? How are these connected with your neuroendocrine? You see, your neuroendocrine are the chemicals in your brain, like dopamine, serotonin, GABA, things that give you pleasure, that gives you calm down of your brain, that give you excitation, that gives you, Parkinson's, dementias, Alzheimer's. Your brain is essential. And everything's connected. So let's say for your, let's say with the neurotransmitters, how can your neurotransmitters be connected to, let's say, your endocrine system, right? Or your digestive system? Well, digestive system, let's say that you are depressed, okay? You went to your doctor didn't do any tests to identify your depression. They just said, I'm gonna give you an SSRI. This is a medication, the reuptake inhibitor of serotonin, right? And the reason why, because they believe that you don't have enough serotonin, because serotonin is your happy neurotransmitter. And that means that you're not happy, so therefore you're depressed, right? So they give you the medication. But in reality, if you start looking at the infrastructure and root of cause, you might stop and think and say, all right, where is my serotonin produced? Where 80%, about 80% anyways, of your serotonin is produced in your digestive system. You see the connection with that? If you're not producing serotonin, that could be the reason why you're depressed. But have you ever heard a doctor put that together for you to say, hey, let's look at the digestive? But you see, the integration of the infrastructure of who you are is balanced by these systems. And if we can look at all the systems and find those irregularities, then I know that those other systems will help and create health. And this is the reason why I'm talking about this. This is how I help other chronic diseases that you might be dealing with, or whoever's dealing with, in which I'm going to give you an opportunity here in a minute to deal with it also, right? But bringing it back to the thyroid, right? Let me give you just an overview into understanding the thyroid. You already know that I'm going to help you in chronic disease, besides just the thyroid, differently. But since we're talking about your thyroid and you're really researching the thyroid because that's really what concerns you today, then this is just an overview. Right? Remember, the government of your thyroid governs the thyroid. It's your pituitary through the TSH. Okay? TSH, okay, tells your thyroid to produce T4, okay, which is an inactive hormone. Right? T4 will convert to T3 in the gut and the liver, which is activated hormone. We want the absorption, and the one that tells us the best gauge that we're going to look at is the free T3. And to us, that's the most important one. And that's the one we're going to be looking at. And like I said, I will give you the gauges. I will give you, because in ranges, they're very broad. Okay, I'm going to give you the optimal range that you really need. That's going to really change your life. So again, autoimmune. From there, autoimmune. In this kit that I provide for you, I'll be testing those. I will tell you the TPO, TGAs. If those are positive, okay, if you have a sign that you do have this attack, and if your thyroid is decreasing the production of T4, then it's called Hashimoto's. And if it's increasing the production, it's called Graves' disease. Now we're dealing with what? Autoimmune, right? Now we're doing with digestive leaky gut, and we'll talk about all those in a different talk. But this is what I'm bringing to you. This is how I deal with my patients. This is what life is all about, in providing for you information that's going to change your life. Okay? I hope that the light turned on today, and that, hey, Dr. J, you really brought some great information. Well, it's not just about information. I didn't do my job if I didn't motivate you to take action. And I want to motivate you to take action because obviously you are sick. You need help. Your symptoms, all these different symptoms that you didn't remember, it affects every cell of your body. It affects everything in your system. Okay, it's affecting your emotions, affecting relationships, it's affecting work. I'm too tired, I'm too sluggish, my productivity is not there. My family doesn't want to do anything with me because I can't do anything. I'm emotional imbalance. I have depression. You see, all these different things, it's because you're dealing with those issues of thyroid, and you need to get up and take action. You need to get motivated and really live that life that you really need. I'm bringing to you this kit, okay? It's called the IW method thyroid kit, in which I'm going to provide for you a requisition for a blood test, which you go get the blood test. From then you get the results from us. We'll give you a program where you just plug in those results, and it will tell you exactly what to do. In here, we'll talk about what medications you're taking. And again, I don't have the power to get you off any medications, but you do. And we'll tell you an advice of what to do. Again, we'll provide all that information in which you'll learn how to balance that thyroid. And the substance that I'll be providing for you is got to be monitored by those blood tests. So we'll tell you exactly what to do and how to do it. But you know what? You're doing it on your own. If that's what you're looking for, and most of us are looking for the less expensive, the most less time, save time and money, right? That's all of us. So again, if you want to do this kit, right, I do have this online. And if you want to take action today, well, I'm not saying if, take action today, right? Let's motivate ourselves. My kit is worth, the charge of my kits right now, the cost is $327. You just went with me about 25 minutes learning what this is about. I'm going to reward you for that. So for that, I'm going to discount $100 off of it. And I want to make sure that money is not the reason why you start really balancing your life. So I'm going to charge you $227, okay, for this IW method online kit for thyroid. Okay, it has everything to do with you. We have no hands into it. You're just going to do it on your own. Okay, so again, take action, $227 to really find a different solution, a guided solution, and an organic substance that's not the typical supplements that you're taking today. Okay, now, if you have other diseases and other dysfunctions, and you say, Dr. J, I really want somebody to guide me step by step of how to really reclaim my health, then I do have that for you. Then you're going to have a consultation here with my office, either with me or my staff, and we're going to provide the information for you. We're going to create a case of action for you. We're going to look at the integration of those health systems. Which one are you out of place that's not giving you your help? And that's how we're going to provide that help for you that you've never gotten before. Right? According to, and again, that's what this consultation is about. In my consultation, I'm going to give you 1 hour of my time. Okay? 1 hour. And listen, you're not going to get an hour of any doctor to really go out there and find out what's going on with you. Okay? This is the healthcare system that we live in today that is completely corrupted and dysfunctioning. And in 5 minutes, there's no way you can get a diagnosis. I want to really change your life. And if you want to really looking for, you're motivated and you want things differently done and learn how to do it, I have the solution for you. All right. So our first step is to create a consultation. Right. My consultations is 1 hour, and the cost of that is $287. Right. Like I said, I'm going to reward you. You just went through a pre-education process. I don't have to explain this to you again when we get into the consultation. So therefore, I'm going to reward you for that. Okay, you're saving my time. I want to save you money. So my $287, what I'll do for 1 hour of my consultation, I will charge you $87. It doesn't cover my time, okay? And that money does not cover my time. But at the end of the day, it's not about money. It's about really finding out if what we have here can really change your life. Okay, and I'm not looking to give you a supplement to change your life. I'm looking to look at the root cause of imbalances that can change your life and educate you how to sustain it. And that's what we're all about here in my office. I have an awesome team that will provide that for you. So again, $87. You have nothing to lose. 1 hour of our time. Create a consultation. I have a link below. Click on the consultation. It'll take you to a place where it's a schedule. You schedule your own time. And then from there, also, I do charge those $87. I pre-charge those. Again, I'm going to, schedule and take 1 hour off my schedule. I expect somebody that, puts skin on the game, is that you're serious and you want change in your life. Okay, let's start. Let's begin. Click on the link below for your consultation. So remember, you got two choices. You want to take action today. Either one, I'm here for you. You want to do it on your own and understand what's going on with you? Hey, do the kit. That's why I did it. That's why we have it. If you want help because there's other issues and you really feel that Dr. J can really bring some solutions to you, which I will, all right, then give me that consultation for $87. All right, click on the link before. Guys, let's get back on our health. Let's get back on a God-given ability to feel better, to be energetic, to really have a relationship with your family members, your spouses, and bring that life back that God wants you to live. A prosperous, happy, healthy, and again, but we have to do something for our bodies. Some of us, we've let our body take care of us for a long time. Now it's time for us to take care of our bodies. And the older we get, the more we need that. So I really advise you to take action and take action today. All right, we'll see you soon. God bless. I'm Dr. J.